Now is A Healthier You.
A Healthier You is brought to you by Express Fitness. Your goal is our mission. Medical Associates, healthier people, a better world.
And Horton's Pharmacy, the art of dispensing and caring since 1920.
And this morning, my very special guest is Dr. Stephen Thomas, MD, Chief of Infectious Disease, Director of the Institute for Global Health and Translational Sciences, and Director of Infection Control, SUNY Upstate Medical University. Good morning, Prof. How are you this morning?
Good morning. I'm well. Thank you.
Well, it is great to be hearing you here in Jamaica. I'm sure it's probably very cold where you are.
That is correct. Yes, we have snow.
Well, time for you to come to Jamaica.
Sounds good.
Great to have you. Now, you know, the world is shocked by the discovery of a new virus. Now, we have been referring to it as the coronavirus, but I understand that refers to a group of viruses, and that this new virus is actually called the novel coronavirus. Am I correct?
You are correct. So the human coronaviruses were first identified back in the mid-1960s, and we believe there are about 7 different coronaviruses that can infect people. 4 of those coronaviruses cause the common cold. They cause upper respiratory symptoms, usually in a seasonal way, usually in the winter, and they're usually quite mild. But there are 3 other coronaviruses which have caused significant disease in humans. The first was the SARS coronavirus, which was a pandemic and infected thousands of people and killed almost 800 people. And then the next severe coronavirus was the MERS coronavirus. So that's the Middle Eastern Respiratory Syndrome coronavirus, which is predominantly found in the Middle East. And that's also infected a couple thousand people and has killed almost 800 people. And then now at the end of 2019 and continuing today is the third severe coronavirus that's been identified, and this is the what we're referring to as the novel coronavirus.
No. Is it really new as such, or is it that we scientists have just discovered it?
Well, that's a great question. So I think that, the thinking right now, as often happens, is that, you have viruses which exist in people, and you have viruses which exist in animals. And sometimes what can happen is that the viruses that are in animals can, what we call jump species, so they can go from an animal to a human, and they can adapt to being able to infect the human and replicate in a human. So the virus has probably been around in animals for a very, very long time, but we do believe this is the first time that it's been seen in people, or at least it's the first time that it has caused a major outbreak of illness in human populations.
Have they been able to ascertain, or they don't know, because my understanding is that they're still studying this virus. Do they know how it jumped from, if that's possible, how it jumped from the animals to human beings? Is it by eating animals?
Yeah, that's a great question, and you're right. I don't believe that they have a complete understanding yet, but they're certainly they're looking into that question, and they're doing the research to try to understand that question. We see this with other types of viruses. We've seen this with SARS virus. We've seen this with MERS-CoV. We've seen it with non-coronaviruses, so Nipah virus, for example, where, virus can exist in animals like, bats or non-human primates, monkeys. It can exist in birds, and somehow, whether it's a human gets exposed to biologic products from the animal, whether it's saliva or it's excretion, urine or something of that nature. They somehow get exposed to that, and the virus starts replicating in the person, and then that person can infect somebody else, and then the process just seems to continue, and the cycle seems to continue. But specifically, I think you're correct in that they don't really know yet, but that they're looking into that.
Yes, and the reason I ask that because there's quite a bit of speculations going around as to how it has come about to move from animals to human beings. Some persons are saying it's because in some countries they eat wild animals and so on, and that's why I'm glad you made that very clear. Now, the virus spreading, it's very clear that in China steps have been taken to control the virus, and some of these steps seems quite extreme. What do you think? What should other countries follow suit? They say, fail to prepare, then prepare to fail.
So I should ask you, what measures in particular are people thinking might be extreme?
Like they have locked down certain areas in China, I understand, and freedom of movement is not allowed in areas where you have a number of persons who have come down with the novel coronavirus.
Right. Yeah, I thought that you were probably referring to the travel restrictions.
Right.
And the
right.
Movement,
that too.
Movement restrictions.
Mm-hmm.
Yeah. Well, I'll be honest. I don't feel like I'm in a position to certainly not to criticize, but also not to comment on the measures that they've been taken. Because when I look at how this virus is behaving in terms of every single hour, the updates in terms of the total number of people that have been infected, which is almost 4,500 people right now, and the total number of deaths has passed 100. It's now about 107 as of 15 minutes ago, and all those deaths are occurring in China. And then I think about the densely populated areas. The number of people who, by the way, because this is a new virus, there is no immunity within the human population, and so everybody ostensibly is susceptible to this virus, and the virus, we feel pretty strongly, is being transmitted from human to human, likely through respiratory droplets, like the common cold is, or seasonal influenza is transmitted between people. I understand that the medical system there, which was already a stressed medical system because of the large size of the population, the medical system is under great strain right now. They do not have enough resources to test all the people that they suspect may be infected. And if you look at the total number of people that have been infected, which I just mentioned is about 4,500, around 20% of those people are being considered to have severe disease. So these are people that need to be in the hospital. They might need to be in an intensive care unit. Again, they're consuming lots of resources. And so I say all of this to kind of describe a situation which I imagine is very dire. And so I don't feel personally, I don't feel like I'm in a position to comment on what the government is doing to try to slow down the transmission from person to person. I've read that some people have mentioned, about 5 million people have already been able to leave affected areas, and that this is not the appropriate way to do things. But considering me not being there and me not truly understanding what that society and country is dealing with right now in terms of this crisis, I don't feel like I'm in a position to comment. What I can say is, though, they're doing lots of other things which I think are quite good. So, first and foremost, and there may be debate about the timing of this, but it appears that they reported very early to the international community that there was something going on. That's a good thing. That's not always been the case. They have shared very important information about the genetic basis of the virus, and that genetic basis is allowing people to develop the diagnostic tests that are required to determine if somebody's infected or not. People, other just general public health things that people should do: frequently washing your hands, avoiding areas with, if you can, that are densely populated with lots of people, avoiding people who are clearly ill, avoiding people, just making sure, again, if you are ill, to wear a mask and to notify, the medical authorities where you live that you are sick and that you may have been exposed to somebody who was from that area, or you are from an area where there is an outbreak.
As you're aware, Doc, when you have something like this occurring, the speculations just take over. There are persons, for example, as they are now saying, why these new viruses are coming about in Africa, in Asia. Have you done any research, or your university done any research to find out exactly if this is so, and probably why is this happening?
Yes, I think there are a lot of drivers of emerging infectious diseases and reemerging infectious diseases, and a lot of those drivers come back to human behavior. So population growth, urbanization, so lots of people who may be susceptible to certain diseases moving very closely together. Mm-hmm. Our practices with different things that we do that put us in very close contact with animal populations, whether they be domestic or wild animal populations. Things like deforestation, so limiting the natural habitats of animals and mosquitoes and birds, etc., which bring them closer again into human contact.
Oh, that's interesting.
Yeah,
because I hear it's happening.
So anything that would put us in close contact with species that we're not normally in contact with provides this opportunity, for different viruses or other pathogens to jump to humans. Then you have a bunch of humans who live together who are not immune to these pathogens, and you get an outbreak. Because
we're encroaching on their natural habitats, happening in Australia, parts of Africa. I see. That is quite interesting. But I'm going to ask you a question, but this is really subjective, if you ask me. From your where you stand, and I'm sure you're probably in contact with scientists across the world, and probably in China too. Do you get the impression, you did mention before that the authorities came out early in the day, but there's this perception, because the society is a totalitarian one, that information is being restricted. From where you sit, do you get the impression that we're getting the full story? We're hearing about 4,500 persons are now affected, over 100 has died so far. From where you sit, do you get the impression that the figures could be much larger?
Well, I think just what we know about how viruses behave when they infect people, I absolutely think that the number of people that have been infected is probably much, much higher. I've read some epidemiologists and modelers believe that the number might be 30 times what we think. But that's kind of typical. So you have a population of people who get exposed to a virus. There's going to be a large percentage of those people who don't even know they've been exposed. There's going to be, because they're not sick, there's going to be a percentage of those people who get a very mild illness and they don't even go and see their doctor or medical professional. And then they're going to be the people who get truly sick with what we kind of will then say, okay, this is the case definition of novel coronavirus, fever and cough and lower respiratory symptoms and muscle aches and fatigue and shortness of breath and abnormal chest x-rays or CAT scans. That's kind of a very smaller percentage. And then at the very top, you're going to have the people who have very severe disease or have atypical manifestations of disease. And the only the only categories that authorities or scientists or medical personnel are going to be able to see are going to be those top two categories. So I absolutely expect that there are many, many, many more people who have been infected, but they just haven't, because they're not sick, or they're not sick enough to kind of present themselves, and so they're not being counted. Now, whether there's any whether there's opportunities to improve communication, again, I don't want to evade your question, but I feel like I'm not in a position to make that judgment, because I really don't understand, and I don't think many could understand what the situation is like in these cities and in these provinces and at the country level. And I'm sure they are just trying their best to stay above water in terms of taking care of people who are presenting with clinical illnesses that could be consistent with novel coronavirus. And the other thing, and this is especially important for at least where I live in the United States. I am much more concerned about seasonal influenza than I am about introduction of novel coronavirus.
That's interesting.
Why? Where I live in central New York. I mean, our Centers for Disease Control estimate that there have already been, this season alone, and we're not done yet, 15 million flu-like illnesses. There have been 140,000 people hospitalized, and about 8,200 people have already died from influenza in my country. So that's another dynamic to these epidemics or pandemics, is that the routine seasonal things that are still very, very bad.
If you have vaccines for those seasonal flu,
you're in a completely different part of the planet, and you're not right, and you're not sick yet, or you may not get sick. So so your points are well taken, and I think that's where the travel recommendations of the CDC every single day, multiple times a day.
CDC, that stands for Center for Disease. Yeah,
it's our Centers for Disease Control and Prevention, and they're located and headquartered in Atlanta. So they every day are making updates to their travel advisories, and so right now there's a level 3 travel advisory for China, which basically means if you do not have essential travel planned, you really should.
Professor, sorry to interrupt you, because we only have another 2 minutes or so. But you can, although our knowledge so far is limited in terms of this new strain of virus, the novel coronavirus, could you specify so far what we have found out in terms of how the disease can be transmitted from one person to the next?
Well, we believe that it's transmitted similarly to how SARS and MERS-CoV and other coronaviruses are transmitted through respiratory droplets. So somebody sneezes, somebody has a runny nose, and that other person, and within those little droplets that are kind of floating in the air after somebody sneezes or coughs is viral material. And if you're within a certain number of feet of that person, you can breathe that material in, and now you've become infected. And then the virus will replicate in you, and then if you become sick and you cough and you sneeze, then somebody else can get infected.
Yes. And last question. At what point, I think it's the WHO, that's the World Health Organization, we know probably determined whether or not this is a global challenge. And do you see the possibility of countries actually closing their borders?
At this point in time, I do not believe so. I think, and I think it's, they did not call it a public health emergency of international concern. They did not do that yet, and I would agree with that decision, because I do believe there are still lots of unknowns, and unfortunately it just takes It takes some time. It takes observation. It takes continued study. It takes a lot of communication to understand some of the key elements, many of which we've discussed, with a little more detail so that you can make informed decisions that are going to be hugely impactful to lots and lots of people. There are a lot of information in the papers about the huge economic impact this is going to have on China specifically, but also potentially the region. So these are decisions that should be made with a great deal of information to support them.
Right, and I guess with China, a large population of what, 1.3, that's something else.
Right,
Prof,
right.
I want to thank you. Boy, I see you're so involved. You're a professor of medicine, professor of microbiology and immunology, division chief of infectious disease. I got it all right?
It's perfect. Thank you very much.
You specialize in internal medicine and infectious disease. Thank you very much, Dr. Stephen Thomas, MD, Chief of Infectious Disease, Director of the Institute for Global Health and Translational Sciences, and Director of Infection Control, Sunny Upstate Medical University. Thank you very much. Have you ever been to Jamaica?
I have. I'd
Good.
love to come back.
All right, Tim, when the trouble starts, you make sure you find Jamaica. I think we're doing our best to make sure that we kind of keep that cruel thing far from our shores. It was great to have you talking to our people here in the West Indies. You have a wonderful day, Dr. Stephen Thomas.
You too. Thank you very much.
Have a great day. All right, there you have it for Healthier. You're going to go for the break, and when we come back, yes, it's going to be Farmers Forum.